Hello, warriors. Hello, healers. Welcome back to the podcast. If you're listening to this on the Prepared Patient podcast, or if you're watching the video format of this on YouTube, welcome. Um, I am going to show you guys some screens. So if you want to see what I will be discussing, I would love for you to head over to YouTube. If you are listening to this on the podcast, there should be links in the show notes below. So you can join me and view what the others are viewing on YouTube. If you're new to my platforms, you've never seen me before, never heard me before, and you stumble upon this page, I'm going to take 2 seconds to introduce myself. My name is Dr. Jennifer Genty. I am a functional medicine practitioner, holistic medicine practitioner, integrative medicine practitioner, natural medicine practitioner, and my passion is to help my patients restore, repair, rejuvenate the function of the bodies, whether it's hormone imbalance we are dealing with, or weight loss, or gut issues, mold exposure. But I help them restore the most natural way. Okay, we use herbs in our practice, we use food as medicine in our practice, we use detox in our practice. And if you live in the New Jersey area, you will know that we also have a clinic where maybe you don't know, we also have a clinic here in Denver, New Jersey, where we can incorporate some IV vitamin therapies into your treatment plan. So welcome, welcome, welcome. And this podcast slash YouTube video is different as I am going to discuss two special events that are happening in our practice that I know for sure you can benefit from. And it's going to be a special invitation as well, because as I've been helping so many patients with different ailments, different symptoms, different diseases, I'm noticing there's a huge need for hormone balance, menopause treatments. And that is what I am going to discuss with you. Now, I've been running a series on my Facebook page, Jennifer Gen Z, and also Instagram page, Wellness Corner NJ, but mostly on my Facebook page. I did a mini series last month in December. We talk about all things hormones, what it means to have hormonal imbalance, how it is such a broad term. We don't know what it is. You have to really be more specific because our bodies produce and also experience 60 plus hormones. So we have to be really, 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 really focused and really specific of what we mean by hormone imbalance, okay? And also like the different hormones we need to consider when it comes to menopause, perimenopause, postmenopause, or hormonal imbalance. I did a mini series about estrogen. We talked about PMS, PCOS. We also talk about progesterone. We talk about like the testing you should be evaluated, assess. That's gonna give you true reflection of your hormones that are imbalanced, the true pictures. So again, if you are listening to this on the podcast, I have some downloads on the podcast where you can go back and listen to those hormone mini series. But what I've noticed is that many patients are reaching out to us, many people are reaching out to us asking tons of questions in terms of menopause, right? Hormonal imbalance, perimenopause, heavy bleeds, heavy menstrual cycles. And I got to thinking about how I can serve many people by really answering the questions and show them all the possibilities and the ways they can heal the bodies, eliminate a lot of those menopausal symptoms naturally with ease without trying everything under the sun. So that's what I would love, love, love to invite you to, two things. So the first thing is I would love to invite you to a masterclass that I'm going to be hosting next Monday, January 15th, 2024. The time I'm recording this, it is a Tuesday, January 9th, 2024. So by the time you see this or you listen to this, it'll be Wednesday, January 10th, 2024. I'm hosting this powerful masterclass, how to restore your brain, your body, your weight, and your health back from menopause and hormone imbalance. Again, because so often when we think about menopause, we think about hot flashes, we think about night sweats. We don't think about the most common symptoms that many of us experience as we transition to transition from pre to peri to full menopause. And a lot of my patients that are part of my hormone and sex survival program are literally experiencing tons of cognitive decline, whether it's brain fog or foggy thinking, or whether it's the poor memory, mental sluggishness, whether it's mental fatigue, lack of motivation, lack of concentration, lack of focus, like they just don't feel great. And sometimes they just don't want to do anything, right? The desire to do things are not there. So that is why we need to really look at the symptoms that you could possibly experience as your hormones are in balance. So in this masterclass that I'm hosting next Monday, January 15th, I'm gonna show you how menopause or hormone imbalance affect your body. We're gonna go over the symptoms, how this disease or condition can also affect your brain. We're going to go over the symptoms of that one as well. And your health, we're going to go over the symptoms, and I'm referring to, PCOS, endometriosis, fibroids, just weight gain around the midsection, inability to lose weight, bloating, skin issues, hormonal acne, hair loss, like a joint issue, back issue. I mean, there are over 80 plus symptoms. I know for sure 36 that I've seen in many of my patients combined of symptoms of menopause. Okay, so we need to really sit down and evaluate and learn and get the information, get the knowledge of how many of your symptoms you might be experiencing now could be part of pre, peri, and postmenopause. And one thing that I'm realizing that many patients are going through this phase and they're not even aware of it, because society is telling us that when you are in menopause, you're supposed to have hot flashes or night sweat, um, dry vagina, right? Decreased libido. And many people don't have those symptoms, right? Many people have different types of symptoms. And because they have different types of symptoms, they are not looking at the hormones and they are not evaluating hormone imbalance. They're not even thinking about hormone imbalance because it's the brain fog. They're gonna go see the doctors for brain fog. They're gonna go see the GI doctors for gut issues. They're gonna try to lose weight again because they're not having the classic signs of symptoms. So I'm going to share my screen because down below in the comment section below, you're going to see two links. The first one is, hold on. So again, if you're watching this on YouTube, you'll see me share my screen. So the first one is the hormone imbalance or menopause masterclass. So this is the link. I'm going to put the link. When you click on the link, you'll be able to see this page here where you give us our information. Again, the topics we're going to be discussed is the truth about hormonal imbalance in relations to your brain and your weight, right? Because I don't want you to spend energy, money, and finances on weight loss products, weight loss injections, weight loss, gimmicks that will not work for you. Why not learn how to balance your hormones? Why not evaluate the hormones that are in balance for you to lose the weight and keep it off? Okay, because I've seen so many patients have tried, Ozempic, Wegovy, like so many different weight loss products. And then once they stop with these products, the weight came back. They never really, truly identify the root cause. And that's why they're not losing the weight. So in this masterclass, we're going to talk about the different phases of menopause because most of us are fully aware of postmenopausal, but a lot of young adults, a lot of, 30 plus somethings or 40 plus something year old patients are going to pre or perimenopause and they're not even aware of it. And I'm going to go over different ways how to get your body back, right? Because I hear so often patients tell me, I don't know, Dr. J, I feel like my body's out of whack. My hormones are out of whack. I don't know what's happening. I used to be, I used to feel this way and I'm feeling that way. I don't know who to turn to. The blood tests that the doctors are doing are coming back normal. So I'm going to show you what I do with my patients, what I did when I was going through perimenopause to get my body back. Okay. And I'm also going to show you ways to handle your symptoms without medications. And that's huge because when we think about menopause, we think about hormone replacement therapies like the patch, the gel, the pill, when in fact you can get similar results incorporating other things like herbs. Because I have great herbs for hormones, I have great herbs for menopause, for PMS, I have herbs for PCOS. So you can literally use what, the techniques and the methods that our ancestors used back in the days to balance your hormones. I don't want you to put all your eggs in one basket, thinking like, if you don't do the synthetic hormone replacement therapies or the bioidentical medications, you'll not balance your hormones. Okay. So we're going to talk about the truth about hormonal replacement therapy. I'm going to, again, walk you through my philosophy and the method that I use to help many of my patients balance the hormones, recover from menopause, okay? So that they can have a beautiful rebirth, a beautiful transition back to themselves. Okay, we talk about prices because we practice with integrity in our practice. We'll talk about what it will cost for you to, really regain your health and get again your brain back, your body back, your weight back, and feel your best. And of course, there are so many informations out there. There's like information overload. When you Google menopause, you get like a zillion research. Okay. And just like I'm telling you this method works, you might also hear from another doctor that's telling you his or her method work. But I really want to show you research-based information so you can have discernment and choose what to do. All right. And then, of course, you can have an opportunity to speak my brain, answer any of your questions. It doesn't have to be about hormones. We can talk about weight loss because I've been on both sides of medicine, of the medical world. I've been in a conventional where I've used metformins and medications to help patients lose weight and balance the hormones. And I've also been on the functional medicine side where I'm using right now, currently using herbs and different gels like natural remedies to help patients balance the weight. So if you suffer with any type of hormonal imbalance, you suffer with any types of menopause, perimenopause, heavy menstrual cycle, pelvic pain, bloating, your mood is altered, you have like, menopause brain, which is the fogginess, the sluggishness, the irritability. Like if you feel like your body's changing, you're not yourself, and you don't know what to do and you've tried so many other things and you're not getting results, I want you to come to this masterclass. Okay, I really want you to come to this masterclass. Again, we're gonna put the link below. You can register for this, invite your friends, invite your, other female leaders in your life to join you and just get the information. Come with a pen and paper and literally learn how to balance your hormones. Okay. And we're going to talk about this. I'm literally opening up the curtains so that you can see everything that I do. In my practice, the herbs that I look at to balance the hormone, and these are Chinese remedies that have been in existence for years. For years. I'm not using anything new. Okay, so happens many of us have literally forgotten about Chinese medicine, natural medicine, and because we go to doctors and they're prescribing medications, so we tend to hold on to that. But I also want to open your eyes and your awareness on the other part of medicine that you should also consider, right? You should have both knowledge in both so that you can really inform your decision. All right. So that's what I want to invite you. That's the first thing. Again, it's going to be an hour. We're going to cover a lot. I don't know if an hour is going to be enough, but I really think you should know if you're female, you have ovaries. Even if you don't have ovaries, you have hysterectomy. If you have like sex organs, it doesn't matter. Like this is information you should know. I don't want you to really transfer your care, your health into somebody else's hands. It should be a partnership relationship where you are working with the doctor and restoring your health. Okay. And the best thing I can do is to give you the gift of information, the gift of education, so you can know exactly what to do to communicate effectively with your doctor and restoring your health. All right. But if you don't know what you don't know, so then you won't know how to advocate for yourself. You won't know if what the doctor is doing or prescribing is the best for you. So again, how to restore your brain, your body, your weight and gut, right? I forgot the gut, and health from menopause hormonal imbalance. So you want to restore all these organs from menopause and hormone imbalance. And you deserve to know what your doctor is keeping from you. All right, so that's the first thing. You see the link below. Please register. Can't wait to see you on Zoom. Once you register, you're gonna get an email right away with the Zoom link, okay? And then you'll be squared away. Now, the second thing I want to invite you and for you to consider, if you have any type of hormonal imbalance, anything at all, right? If you're 30 and older, my hormone and sex survival program is open. The door is open. And what is this program? This is a program that I use right now for many of my patients to help them feel energized and vibrant, improve memory, motivation, concentration, for them to feel good and look good, healthy skin, healthy hair. Because again, these are all the body system that hormone imbalance, menopause, perimenopause can affect, specifically the brain and the energy. Okay, so this program is epic. It is beautiful. We have been getting so much nice feedback for patients that are currently in the program that I had to open the doors early. All right, so it's not just your hormones, we're also addressing your sex, your libido as well, because this is part of you being the person that you are, right? So we also have to address that. So this is open. All you have to do, we're gonna put the link below if you're ready. If you're like, okay, Dr. J, I think I'm ready. I mean, I know I'm ready to take action. I'm tired of suffering with hormone imbalance, menopause symptoms. Like, please help me. So this is for you. So we're gonna go through this. With the page, there are problems that society said that are normal. I don't think it's normal. So I'm gonna bring them to your awareness in here. And again, this is what I used for myself when I was going through perimenopause a year ago. And this is what I'm using right now for my patients. I have 5 patients in the program. One has PCOS, one has endometriosis, one is fully postmenopausal. And before I even release this program, I also use the herbs and the techniques and the methods and the meal plan, all the things on my 2 team members I have, Marilyn and also Lynn, because one is going through perimenopausal and Marilyn is in full-blown menopause. So this is it right here. I would love for you to give it a look, read it. This program is amazing. It is everything that you've been waiting for, plus more. And one thing I want you to understand, when you work with somebody like myself, a functional medicine doctor, we don't just give you pills and capsules. My programs include everything. When I say everything, I am talking about the herbs, I am talking about the meal plans, I'm talking about all the products that you need to help you restore the function of your body. All right. So with this one, you'll see, some myths. I'm busting some myths here, but what's in the program? So the first thing you'll see, there's a kit. We have blood tests included in, I'm sorry, you have a saliva test included in the program. Before we go into the program, I want to test to see which hormones that are in balance. Okay. And then after that, we're going to move into a full liver and kidney detox because we have to remove what's there already to create space and room to add new things. And then that's when we move into the hormone and sex restoration kits. This kit has something for hormones, some things for libido, some things for brain, some things for like the hormones that are imbalanced. There's some estrogen in there, progesterone in there. I also have some DHEA in there. So there are so many things. And I also put my weight loss capsules. Again, when we go to hormonal imbalance or menopause, there's a huge component of weight, right? Many of my patients want to lose weight. They gain weight around the midsection area, and we don't want that. And there's a hormone balancer diet or healthy recipes. I would say this because the way you eat for your hormones, to balance your hormones, to get rid of menopause symptoms is different than the way you eat for other, elements. So that's that. And then, of course, you're going to have access to a powerful community. We do coaching. There's weekly monitorings, bi-weekly coaching. There's so much in this program. This is literally like a $15,000 to $20,000 program, and it's only $8,000. And there's also meal plans. I'm sorry, there's also payment plans. Okay, and this is gonna restore your body. It's gonna give you a sexy back. It's gonna give you a brain back. So I have a patient that's been in this program for only 2 weeks, 2 weeks only. And then we have our patients do like a hormone evaluation questionnaire, because before we meet, I want to know what's working, what's not working. And then that patient, 2 weeks, she started in December. And we're in January, mid-December, in January, she's already seen tons of increased concentration, increased motivation. Her mental sluggishness is decreasing. She's having energy. She's having stamina, like just 2 weeks. So I promise you, this program works, and this program will literally get you results. Okay? So, of course, I know you have to, you have questions, you might be on the fence, and you have a lot of things happening. So these are some of the reviews, patients that have hormonal imbalance. One has menopause, the other one is, heavy menstrual cycle, bleeding, PCOS, fibroids. But you can literally click here. If you're ready to talk, we can talk. I can answer all your questions, but I don't want you to go to 2024 feeling the way you felt in 2023. So this is the program for you. This is the program you have been waiting for, and I just want to deliver to you and put it in your hands. Okay? So this is it. All right. So if you have any questions at all, please send it over. You'll see the info at drjgenty.com in the comment section below. We have our phone numbers in the comment section below. You can Google us. You can literally reach out to us. There are so many ways. And I would love to see you on the masterclass next January. Do not miss this. I guarantee you, you don't want to miss this. This is the masterclass you've been waiting for, not only to answer many of your questions, to acquire information, to to connect the symptoms you've been feeling back to what is happening in your body. All right. Again, it's happening next Monday, January 15th, 2023 at 5 p.m. And you don't want to miss this. We're going to spend an hour together. I'm going to literally deliver all the information, all the things that I want you to know, that you should know, that your doctor should tell you, to help you inform your decision, to see what you need to do, where you need to focus, to really restore the function of your body. Like, it doesn't make sense to feel the same way with the cognitive decline, the poor memory, the forgetfulness, the foggy thinking, and also to continue losing weight and trying all the things that might not work without looking at your hormones. To me, that's like insanity right there. So click the link below to register for the Menopause Hormone Imbalance program. And also, if you're ready to get started, you can start, the conversation here, because the minute you sign up for the program, we can send you your kit where you can start the testing. And then when we're ready to do the liver kidney detox, then you'll be set to go. So much going on in this program. So much. It is a 4-month program. I think I said that, 4 months. And within the 4 months, I guarantee you, the way you feel right now will be completely different than the way you'll feel after 4 months. I guarantee you that. All right. So that's it. So I hopefully you see how, what all the possibilities are for you. And hopefully what I just mentioned on this podcast and also in this YouTube video can open your eyes a little bit for you to start contemplating of different ways to address some of your health issues. And hopefully join us in our hormone and sex revival program so I can be part of your journey, part of your success. All right. Please share this with all the people that you know. Share this with, all the female leaders in your life. Don't keep this to yourself, because so many people are suffering silently and they're looking for something like this. And all right, so that's it for me. Until our next podcast, I'll see you, and enjoy the rest of your week. And let's balance our hormones. Let's really feel our best in 2024. Bye.